Hello everyone. Today's presentation will be on the amputation of limbs, and this is Shahala Munaz. What is an amputation? Amputation is the operation of cutting off the distal part of an organ or limb. Amputation at the joint level is called exarticulation. There are amputations for primary indications and for secondary indications, repeated or re-amputations. A primary amputation is performed in the order of primary surgical treatment of the wound to remove the non-viable part of the limb at an early stage before the development of clinical signs of gangrene. Secondary amputation is performed when conservative measures and surgical treatment are ineffective. Amputations for secondary indications are performed in any period of treatment with the development of life-threatening complications. We have several classifications of amputations. Firstly, we would have primary amputation occurs within the first 24 hours, secondary amputation 7 to 8 days after injury, re-amputation or repeated amputation. We have open guillotine and modified guillotine, closed amputation, revised and planned, flap amputations, single flap, double flap. Circular amputations would have 3 steps. The first step is guillotine, second step variety cuff method, and the third step a conical circular. We have several indications for amputations. We have absolute, relative, acquired, and congenital. For absolute, we have traumatic limb rupture, gangrene, injury of 2/3 of soft tissue, injury and crushing of major vascular nervous bundle, injury of bone. And for relative, we have acute infectious process, chronic infection, massive trophic ulcer, irreplaceable deformation of limb, injury of 2/3 of soft tissue, injury of bone on considerable distance, without injury of vascular nervous bundle. Thirdly, we have acquired. We have vascular, like ischemia, diabetes, frostbite, arterial insufficiency leading to death or decay of body tissue. Chronic leg ulcer leading to septicemia. We have infection, for example, osteomyelitis. Malignant tumors like sarcoma. Trauma, or limb buried under, crushed by heavy objects, limb damaged by car accidents, stabbing, gunshot, animal bite, in some cases leading to traumatic amputation. And lastly, we have congenital. Congenital limb deficiency or phocomelia, a congenital deformity in which the limbs are extremely shortened so that the feet and hands arise close to the trunk. Then we have recommended levels of amputations and exarticulation of limbs. For the lower limbs, we have exarticulations in the hip joint, patellar amputations of the hip, exarticulations, high leg amputation, popliteal leg amputations, and pyrogov amputation. For upper limb, we have exarticulation of the shoulder joint, supraloctal amputations of the shoulder, exarticulations, elbow amputations of the forearm, exarticulations. We have several levels of amputation. For the lower limb, we have hemipelvectomy, hip disarticulation, transfemoral, above the knee, knee disarticulation, transtibial, ankle disarticulation, Symes, partial feet, toe amputation. And for the upper limb, you have the forequarter, shoulder disarticulation, transhumeral, elbow disarticulation, transradial, hand-wrist disarticulation, and transcarpal. So we have general principles for amputation surgery that involve appropriate management of skin, bone, nerves, and vessels. So the greatest skin length possible should be preserved for muscle coverage and tension-free closure. The muscle is placed over the cut end of bones through a myodesis, that is a muscle sutured through the drill holes in the bones, and you have a long posterior flap which is sutured anteriorly with a myoplasty, that is an antagonistic muscle and fascia groups sutured together. Nerves are transected under tension proximal to the cut end of the bones in a scar and tension-free environment. Ligation of large nerves can be performed when an associated vessel is present. And then you have larger arteries and veins are dissected and separately ligated. So this prevents the development of arteriovenous fistulas and aneurysms. Bony prominences around the disarticulations are removed with a saw and filed smooth. You have diaphyseal transections which can be covered with a local flexible osteoperiosteal graft, and this maintains the maximal extremity length possible. However, below-knee amputations are best performed 12.5 to 7.5 centimeters below the joint line for non-ischemic limbs. One application guide is to make a limb 25 centimeters long for every 30 centimeters of body length for upper limb. For ischemic limbs, a higher level of 10 to 12.5 centimeters below the joint line is used because making limbs longer than this can interfere with prosthetic use and design. So, essentially, the steps of amputation would be 1. Cutting of soft tissue, and then treatment of periosteum and cutting of bone, and thirdly, stump treatment. And methods of periosteum treatment would be periosteal, aperisteal, and subperiosteal. There's different types of prostheses. There's much more. And this is here. Next, we have a few examples of certain amputations. So, firstly, we have the Colanda amputations. So, this gives an excellent end-bearing stump. This is an amputation of the middle third of the leg. This is Syme's amputation. So this provides an end-bearing stump that is in many circumstances allow ambulation without a prosthesis over short distances. It's an excellent amputation for children in whom it preserves the physis at the distal end of the tibia and fibula. We have Boyd's amputation. So the Boyd's procedure provides a broad weight-bearing surface of the heel by creating an arthrodesis between the distal tibia and the tuber of the calcaneus after talectomy. Here we have Piragov's amputation on the left, amputation of the foot at the ankle part of the calcaneus being left in the stump. Here we have Chopard's amputation, amputation of the foot by metatarsal disarticulation, and we have Lisfrank's amputation. That's the amputation of the foot between the metatarsus and tarsus. And we have the wrist disarticulation and a forearm amputation. And we have common complications in amputations. So we have massive hemorrhage, infection, skin breakdown caused by immobility, pressure, and other sources of irritation, breathing problems associated with immobility, neuromas, joint contractures, bone overgrowth in children. Mistakes of one step of amputation could lead to a conical stump or mace-shaped stump, and mistakes of one step of amputation which could lead to terminal necrosis of bone or forming of large osteophytes, and mistakes of the third step of amputation which could lead to forming of trophic ulcer and phantom pain. And we have chronic osteomyelitis caused by secondary infection inside a wound. Thank you for your attention. Have a great day.